We've all been there, standing in front of the mirror, that one pimple staring back at us, practically begging to be picked. You're just going to help it along. It will make things better, help it clear faster, right? Wrong. Picking your acne will always make it worse and increase the risk of acne scars and hyperpigmentation. But what if, even though you know, you simply can't stop picking at your skin? If your acne isn't that bad at all, but you are left with scars and sores that never seem to heal because you simply can't keep your fingers from squeezing, tugging, and twisting your skin. Then, my friend, you might suffer from acne excoriée or picker's acne, a form of acne belonging to the Dermatillomania family. It is more than just a fancy term for overzealous skin picking. It's actually a psychological disorder where the urge to pick at even the smallest becomes overwhelming, often leading to scarring and prolonged skin issues. Unlike the occasional pimple pop, no judgment here, I get it, acne excoriée can involve hours spent in front of the mirror picking at blemishes that aren't even ready to be touched. The result? Redness, scabs, scars, and a sense of frustration that can be hard to shake. Let's talk about what causes this and what you can do to finally stop before you're left with scars for a lifetime. Welcome back to my channel. I'm Dr. Anne, a medical doctor here to teach you how to best take care of your skin and general well-being. Acne excoriée is a specific form of a broader condition known as dermatillomania or skin picking disorder. Dermatillomania is a mental health condition where a person compulsively picks or scratches their skin, causing injuries or scarring. The name comes from derma, skin, tillo, pulling or picking, and mania, an excessive behavior or activity. It is often grouped under the category of obsessive compulsive disorders, OCDs, but has some key differences. Obsessions. Unlike OCD, which involves persistent unwanted thoughts, obsessions that create anxiety, dermatillomania doesn't typically involve these uncontrollable thoughts and urges. Feeling of reward. People with dermatillomania often feel relief or even satisfaction after picking at their skin, whereas OCD behaviors don't provide that kind of positive reinforcement. Self-injury. Dermatillomania involves self-damage, which is not typical for OCD. Another category it is often grouped under are the self-inflicted skin lesion, SISL, a terminology introduced by the European Society of Dermatology and Psychiatry in 2013. SISL can be defined as any skin lesion actively and directly produced by the patient on his or her skin, mucosa, or integuments that is not better explained as a consequence of another physical or mental disorder. Acne excoriée typically appears in females during adolescence or young adulthood and can cause significant disfigurement and psychosocial impairment. Men can be affected too, but depending on the population studied, the ratio female to male is between 3:1 up until 20:1. The condition often involves picking at real or imagined blemishes, which can lead to scarring, hyperpigmentation, and increased acne lesions, but, and that is very important, can also occur when basically no acne is present and perceived lesions that could potentially into a clogged pore are squeezed and scratched and manipulated until they become a red open wound. If I was a gambler, I am very much not, I would bet money that you have at some point in your life picked at a spot until it was way worse than it was before. I know I have more than once, and I have small marks on my face that I attribute to that. And yes, I knew while doing it that I was making things worse, and still went on and on and on. But I don't suffer from acne excoriée, and neither do you if you occasionally pop a pimple. If the constant picking at your skin feels like something you can't control though, if it takes up hours of your free time, hindering you from doing stuff you'd actually enjoy, or if it stops you from going to social events, school, or work, basically, if it lowers your perceived quality of life and you suffer, then you might have crossed the line. I say might because there barely ever is a sharp line between black and white, but instead a large gray area, a spectrum, if you will. Now, if we know something is bad for us, why do we do it? A great, almost philosophical question.
Did you know that the first Matrix was designed to be a perfect human world where none suffered, where everyone would be happy? It was a disaster.
Yeah, basically that. The urge to pick at our skin can come from a variety of places. Stress, anxiety, boredom. It is usually more than the desire to have perfect skin. For those of us with perfectionist tendencies, that little bump or spot might feel like an intolerable flaw, something that needs to be fixed right away. The problem is the more we pick, the more we irritate our skin and the more imperfections we create. It's a vicious cycle that's not only hard on your skin but can be really tough on your mental well-being too. Picking can happen in two main ways. Automatic picking. You pick at your skin without even realizing it, probably deep in thought, watching TV, scrolling Instagram or reading. Often you'll start running your hands over your face and neck until you feel a tiny, maybe an even invisible irregularity, and then start. I have one spot where a stiff hair will grow right there, and I often find myself testing this area with my finger unconsciously to see if it is re-emerging after I tweeze it. And if it does, I will keep manipulating until I notice and get up to tweeze it again. Focus picking. Focus picking often starts when you are in front of a mirror, or even worse, a magnifying mirror, and are able to closely examine your skin. You zoom in on soon-to-be blackheads, scabs, tiny whiteheads, and then start. This process can take hours and even involve tools like extractors or needles, leading to even more damage and a very high likelihood for scarring. As something considered part of the obsessive-compulsive spectrum, it is linked to anxiety and impulse control. It is not just about wanting clearer skin. It's about feeling compelled to do something that deep down you know isn't actually helping. Picking provides a temporary sense of relief, a way to control something in the moment, but the long-term damage can be significant. And while the scars on your skin are visible, the impact on your confidence can be even harder to heal. Picking can create new wounds and reopen old ones, leading to bleeding, scarring, and in severe cases, infections that require medical intervention. While acne excoriée is usually limited to the face and maybe the neck, dermatillomania can affect all areas that are easily accessible. Think forearms, fingers, hands, or even involve pulling out your hair or lashes, a condition called trichotillomania. Beyond the physical damage, dermatillomania can also have a significant mental health impact. People with this condition often feel embarrassed or ashamed of their visible injuries and may try to hide them with clothing or makeup. This can lead to anxiety, depression, and social isolation, further impacting quality of life. If that all sounds a bit too relatable, don't worry, you're not alone. Up to 5% of the population has been affected at some point in their lives, and many are able to break the cycle and stop. Here are some tips that might help, but before I go on and list them. You can't just will your way out of a mental health problem. Not out of depression, not out of anxiety, and not out of compulsive skin picking. As soon as you realize that these simple tips don't cut it for you, don't hesitate to seek professional help. Your dermatologist is a great first contact, but the issue usually requires a multi-professional approach, including seeing a therapist. Keep your hands busy. I know, easier said than done, but especially if you do automatic picking, anything that will keep your hands from wandering all over your face is a win. Fidget toys, for example, or stress balls, maybe even knitting, anything that works for you. Hydrocolloid patches. If you feel a spot coming up, or even if you have already picked at it, put a pimple patch over it. This not only creates a better environment for healing, but also a physical barrier between the spot and your fingers. You can manipulate the patch, but not the skin underneath. Stay away from your mirror. Like, seriously, especially the magnifying ones. The closer you look at your skin, the more imagined imperfections you will see, and the bigger the urge will become to having a go at them. Now, that doesn't mean doing your makeup in the dark, but practice looking at your reflection with compassion, rather than the critical eye we usually adapt. Treat your acne. Just to be clear, acne excoriée will not go away magically when your acne is gone. Depending on the underlying cause, you don't stop picking when there are no more lesions to pick at, as the compulsive component doesn't vanish. You will just pick until there are new lesions. But in mild cases, getting the acne under control will contribute greatly to your ability to resist the urge to pick. But again, sometimes the urge to pick is too strong to tackle alone, and that's okay. Talking to a dermatologist or a therapist can provide you with strategies and support to manage the picking, so don't hesitate to ask for help. If you enjoyed this video, you will most likely enjoy the ones I linked on the screen here. Don't forget to check out the description box for everything else I offer, and like and subscribe to this channel so you don't miss the next video. See you there. Bye.